Our last guest today is Dr. Mariam Sauer, a gastroenterologist with Wilmington GI. Welcome to the show, Dr. Sauer. It's such a pleasure to have you here.
Thank you, June.
You're welcome. And to begin, can you tell us a little bit about yourself, in particular your education and your background?
Yes, I am originally from Charlotte. I'm a native of Charlotte, and my husband is from North Carolina as well. I trained in Chapel Hill, my undergrad and my medical school. After that, my husband and I thought that maybe we'd like a little change of scene, so we moved to Chicago, and I trained at Chicago, the University of Chicago in Loyola. But then we had kids, and we decided to move back home. Our family is all in North Carolina, and we really liked this area, southeastern North Carolina, and that's how we ended up here.
Well, great. We're glad to have you.
Thank you. We love it here. It's a wonderful place to live.
Yeah, it is a great place to live. Well, I understand you're with Wilmington GI. And so I'd like to hear about your group and where you're located. Let's start by talking about your group.
Well, we are 7 gastroenterologists. There's myself, and I have 6 partners. We are located in Wilmington, but we also work in Brunswick County at the hospital. We really hope to expand more into Brunswick County and eventually have a clinic here and have a big presence in Brunswick County. Right now we're doing procedures at the hospital, but like I said, I hope that will expand. Most of our services are in Wilmington. We're located on Oleander Drive. Anybody that might know Wilmington, we used to be the old bowling alley. We resurrected that building and we made it into our practice. We do everything within GI and liver disease. So we see simple things, we see very complicated things, and we do everything in between.
Wow. Well, some of our viewers may not know what a gastroenterologist does exactly.
Yeah, good point.
So let's talk about that a little bit. Talk about your specialty and what it is you do.
Yeah, gastroenterology encompasses a lot of different things. Even though we are specialists, we see a lot of different diseases and different organs. We treat diseases of the stomach, the intestine, that'd be the small intestine and the large intestine, which is the colon, pancreas, liver. We treat diseases in all of those organs. Some of the more common things that we see is reflux or heartburn disease, constipation, diarrhea, irritable bowel, celiac disease. We also see advanced liver disease. We see colon polyps, colon cancers. So there's a lot of variety within GI. We not only see patients in our clinic, we also do procedures. So we all do colonoscopies and upper endoscopies, which we'll talk about here shortly. But GI really encompasses all of those disease categories and all of those organs as well.
Wow, that's a lot.
It is. It's a lot. It's very interesting work, though.
Well, our main focus today is to talk about one of your specialties, colonoscopy screenings. So let's start with the basics. What is a colonoscopy exactly, and why is it important?
Oh, that's a good question. So colonoscopy, we do this procedure, it's a procedure, and we do it for many reasons. It's important for many reasons. The most common thing that it's done for is colon cancer screening. Why is this important? Colon cancer is actually the second leading cause of cancer death among people over 50 years old. Wow. It's actually the 3rd most common cancer in women and men in the United States. There are different ways to screen for colon cancer, but the way that we use in the United States is colonoscopy. Almost all colon cancers start from polyps. Polyps are growths on the lining of the colon. We are able to directly visualize these with the colonoscopy. And a colonoscopy is just a small, flexible tube with a camera. It allows direct visualization of the entire colon. If we see anything like a polyp, we are able to remove it. If we see anything abnormal, we are able to biopsy it. It's very unique in terms of screening because we're not only able to see things, we're able to do things at the same time. It's unlike a mammogram per se. If you have an abnormal mammogram, you have to come back at a later date for your biopsy. This is not true with a colonoscopy. We're able to do everything at once.
Right then.
Now, we do colonoscopies for other reasons, diarrhea, constipation, changes in bowel habits, things like this. But most often it is used for colon cancer screening. And June, did you know that if everybody had a colonoscopy that actually needed one, that we would be able to reduce colon cancer by 60%?
That's astounding.
Yes. Only 1 in 3 Americans who need a colonoscopy have actually ever had a colonoscopy.
Wow.
It's amazing numbers. It really is.
That is. Well, how often should a patient have a colonoscopy, or when does that begin?
Good question. Yes. So it's different. The average age is 50 years old. So if you're just a normal person, no symptoms, no family history, you should start at 50, not a year later. It's very important. That's when the risk of colon cancer really goes up, is with age. If you have symptoms, and symptoms include changes in your bowel habits, constipation, diarrhea, rectal bleeding, abdominal pain, weight loss, you should come in earlier. If you have a family history of not only colon cancer, but colon polyps, you need to come in earlier, and that generally is 40 years old. But it may even be earlier. If there's any questions, just talk to your doctor. They'll be able to help guide you in that.
If you have none of those indicators, and you've had your first screening one and it was fine, what would be the next one? When would you have the next one, and how many years?
There's different variables in that, but most often it's 10 years. If you have a totally normal colonoscopy, nobody in the family had colon cancer or polyps. Sometimes, if you have polyps especially, or sometimes depending on your preparation, if some things change in your family history, you may have to come back earlier. But it's not something that's done every year per se. Usually it's within 5 to 10 years.
I see. Well, it sounds like it might be kind of scary, and that's why people aren't getting scoped at the rate that they should be. And so what can we, how can we encourage folks to do it? Is it painful? Is it not painful?
Yeah, these are good questions. There's lots of barriers to colonoscopy. Pain is one of them, and I think people have a misperception about that. It actually is painless. At our facility here at Brunswick and at Wilmington GI, we offer painless colonoscopy. We use very advanced sedation, very close monitoring. We are with you from beginning to end. Most people take a nice nap, wake up, and we are completely done.
Don't even remember.
Don't even remember. There is no pain involved in that procedure. There's lots of other barriers to having a colonoscopy. I would say the one that I hear most often is the prep. It's actually the day before the colonoscopy.
I would vouch for that one.
Yes. And, you know, I think people are often pleasantly surprised, because the prep is still the worst part, in my opinion. We've come a long way with preps, though. They are much more palatable these days. It's still a lot of volume that you have to drink, but a lot easier to do. And in all honesty, I would rather drink a prep than have colon cancer.
I hear you.
Like I said, if many people were screened, we'd be able to prevent a lot more colon cancers.
Right, and you're right. Once you get past the prep, it's a piece of cake.
It really is a piece of cake. And
you don't remember anything.
You're exactly right. And people are often pleasantly surprised by this. I have patients tell me every day, wow, if I had known it had been this easy, I would have done this years ago and just had it off my mind. Because like I said, once you get it done, you usually don't need it for many, many years. Your family will stop bothering you about it. Your primary care doctor will stop bothering you about it. Your gastroenterologist will stop bothering you about it. So I always tell people, don't let the fear stop them, because honestly, it's not as bad as one thinks it's going to be.
Now, you said patients take a little nap and they wake up and they don't remember. And I assume that's a type of sedation that you use. Let's talk a little bit about sedation and how that's administered.
Yes. So the day of the procedure, everybody gets an IV, and the sedation that we use goes through the IV. The sedation that we use is very quick on. It's very quick off. The day of the procedure is a day of rest, but it's not like the old days when you would be groggy all day and really didn't have any quality of your day that day. And like I said, we do very close monitoring during the sedation, because it is IV. We give everybody a different dose. We only give you as much sedation as you need. And everybody is awake, walking and talking, knows what's going on, is coherent before they leave. It's not the typical sedation that you have if you undergo a deep anesthesia, let's say for a big operation or surgery. And there are some people that are fearful about the sedation. Many people who want to have a colonoscopy have never had sedation before, and they are fearful of that. But again, it's not the deep sedation of big operations, and that should not make you fearful either.
So if a patient wishes to have their procedure at Brunswick Medical Center, where would they need to go for a pre-colonoscopy appointment?
Yes, that's a good question. They can call our office at 910-362-1011 or at wilmingtongi.com. We will arrange everything. It is not necessary to come into Wilmington for that. We are able to do visits, the pre-visit at Brunswick. Certain people qualify for that, but if you just need your average colonoscopy, we are able to do that, and you can save yourself a visit into Wilmington for that as well. So it's much easier than one may think.
So they wouldn't need to travel to Wilmington,
No.
and your office could
We
determine whether or not they would be appropriate
That's
to have
exactly
it here.
right. That's exactly right.
One other question I have, is a referral necessary?
No, a referral is not necessary. If you are over 50 years old and you have never had a colonoscopy, please call our office. We are happy to schedule you without a referral.
Great. Well, before we wrap up, let's share again your phone number and how folks can go about scheduling their colonoscopies at Brunswick Medical Center.
910-362-1011 or at wilmingtongi.com, or you can visit us on Facebook as well.
Oh, wow. And they can just let your office know that they're from Brunswick County and they would prefer to have
Absolutely.
their colonoscopy at Brunswick Medical Center.
That's exactly right, and we'll facilitate everything.
Great. Well, thank you so much for being
Thank you,
here
June.
today.
It was a pleasure.
What a pleasure. And
It was a
I've learned
pleasure.
so much today, and I hope our viewers will feel confident and safe about having their colonoscopy.
Exactly, and I just want to say one last thing. Please get screened. If you have not had colon cancer screening, please do so. Thank you.
Again.